Hey, my name is Macy, and this is my webpage on multicystic dysplastic kidney. So my target audience is the general public, as well as more specifically just current mothers or potential mothers, because this primarily impacts embryonic development. So here we see it's my intro or my background page into what MCDK is. So basically what it is that it is a condition in which one or both the baby's kidneys do not develop normally while the baby is still growing in the womb. And as you can see here by this image, this is one of the cysts that you can see on the kidney, or it's a fluid-filled sac, which replaces the normal kidney tissue and prevents the affected kidney from working. So MCDK is a rare renal disease that is also the most common cause of cystic disease in children. It is a developmental anomaly during embryogenesis, which is the developmental stage of an embryo from a zygote. It is one of the most commonly detected anomalies on a prenatal ultrasound. And there are two types here. You can see unilateral and bilateral. So unilateral is the most common, and it is when one of the kidneys is affected, and then the unaffected kidney usually does grow larger to compensate for the non-working kidney, and it does the work of both kidneys. Over time, the non-working kidney involutes, or usually just shrinks and disappears over time. And over here, bilateral impacts both kidneys, so that means both kidneys are rendered non-functional and is often more lethal because of it. So getting into the phenotype and the symptoms here, basically MCDK is a severe form of renal dysplasia, which comprises pretty much of a group of disorders in which nephrons in the collecting duct do not form properly with the epithelium. And then so in a normal kidney, the internal structures are formed, but in this renal disease, the normal development is disrupted, resulting in the formation of those multiple cysts of varying size within the affected kidney. So while MCDK, the cause is unknown, it has been linked to certain spontaneous events that occur in the development of a baby in the womb during that embryogenesis stage. This can include medications taken during pregnancy, exposure to viral infections in utero, and even genetic syndromes or autoimmune diseases that one can see and happen in the body that can impact certain systems and then also lead to some renal disease. As for assessment and diagnosis, more in clinic. So it looks MCDK during the fetal period usually occurs during around the 5-week gestation when the kidney develops. And because, like we said, the often unilateral MCDK usually goes asymptomatically, it is often not detected until that prenatal screening ultrasound, which is the mean age of diagnosis is about 28 weeks. While it can be mainly asymptomatic, there are symptoms that can display phenotypes in clinic, which includes like a palpable abdomen area, blank pain, a UTI, and hypertension. So sometimes hypertension or high blood pressure can be secondary to certain renal diseases. And then more tests that can be done in office, a urinalysis and urine culture. These urine tests take a small sample of the urine to check for signs of kidney disease and as well as certain blood tests. And here we see one of the ultrasounds, the prenatal mid-trimester ultrasound, where you can see the different views and the cysts in the area. So tissues. So it's a condition in which one or both kidneys do not develop normally while the baby is still growing in the womb, because of those cysts there and disrupts the development of the nephrons. Here at I included this developmental stage from A to E of the kidney, as well as with certain structures that are important. So in MCDK, basically, the nephrons in the collecting ducts do not form properly, and with the undifferentiated epithelium, the primitive duct is surrounded by fibromuscular connective tissue. So MCDK was a result of a primary deficit in the uteric bed that we see right here, and the failure of coordination between this and then the mesenteric mesenchyme, or also in this image is the blastema. And then so it results in abnormal development of the collecting duct and overall loss of functional nephrons and the formation of those cysts. And over here, distinguishing again between unilateral and bilateral. So unilateral, only one kidney is affected and the functions are disrupted, but often because the other kidney compensates for the non-functional kidney, it does not cause bodily harm. But in bilateral, when both kidneys are destructed, babies are often born with like lung or heart defects if they do make it to term. So more into the genetics. While the exact cause of this is unknown, it is believed to occur due to abnormal induction between the ureter and the developing kidney tissue. So basically, dysfunction between that tube that connects the kidney to the bladder, leading to an inability to drain urine. Most commonly affects the left kidney and also male predominance. And now, while most of this occurs as a spontaneous fit, there are links to a genetic trait. So certain mutations in genes, like we see the EYA1, SIX1, TCF2, and PAX2 have been identified as potential markers. So all these genes play a crucial role in uterine bud development. So of course, any dysfunction in any of these genes can lead to the improper development of the kidney. So diving into specific genes, EYA1 basically provides instructions to proteins for regulating the activity of other genes. So based on this role that we see here, it is called a transcription factor or transcription coactivator. So this protein pretty much interacts with other proteins such as like the SIX1 to activate or turn on or deactivate, turn off, certain genes that are important for normal development. But before birth, these proteins interactions seem to be essential for the normal formation of tissues, which include the kidneys, gives rise to those tissues, the neck, eyes, etc. And then after birth, of course, these interactions are important just for normal organ function throughout your life. And then the TCF2 plays the role for specific regulation of gene expression in various tissues, such as the kidney, liver, intestines, and pancreas, and is involved in the embryonic development of these organs. As you see here, the mutations are associated with severe non-diabetic renal deficits, such as MCDK. And then the PAX2 expression, that one impacts embryonic development, and the mutations mainly occur on exon 2 and 3, and it basically provides instructions into formation of the kidneys, eyes, ears, brain, spinal cord, like central nervous system, etc. And then after birth, it is thought to protect against cell death and cellular stress. So it is expressed here in the uteric bud and the mesenchyme, or like the blastema that we saw on the last page. And then these mutations or loss of expression can cause the uteric bud from developing in a normal kidney. And then more on PAX2 is that while certain pathways of this is still unknown, it is likely that they do impair the function of the kidneys and the urinary system. And then I thought this chart was interesting because these are just a list of other syndromes that have specific genetic factors that are similar, like PAX2 with MCDK, or just are at least similar with the disease, and as well as includes their renal malformations and potential causes. So for treatment and therapies, there is no current treatment for MCDK, and there's also not a way to prevent it yet. But usually it is diagnosed through certain ultrasound imaging during pregnancy or shortly after birth, which is the postnatal. So antenatal ultrasound before birth, postnatal after birth. And it usually does involve pediatrics. So pediatric urologists are often utilized in this to help treat it. And then so observations are important, as well as follow-ups, the serial ultrasounds, which is periodic ultrasounds. And then I thought this image here was interesting because it does indicate unilateral MCDK, because we only see one kidney here when it is a scan of both kidneys. But because one kidney is rendered non-functional, we see that it disappears or involutes over time, like we talked about earlier. And of course, in the worst cases, usually surgery, dialysis, kidney transplantation, nephrectomy in the case of the kidney does not shrink over time. As well as hypertension management, like we discussed, that high blood pressure may be a result from certain renal diseases like MCDK, in which it is important to monitor blood pressure routinely and kind of alter diet and salt intake. And then just other methods of imaging, certain ultrasounds, MRIs, like you can see here, the different views, MRIs of the kidneys. And then current research, this is my animal model study that I found looking at the obstruction of a urinary tract in fetal lambs compared to normal lambs and determining if that influences the PAX2 downregulation expression into the further development of MCDK. So the PAX2 is a transcription factor that we discussed earlier and important for renal development. So in here, lambs were mutated to express, like mutated the PAX2 expression, and then it was observed, and it does look like there was a correlation with developing kidney disease or MCDK further along the line. So overall, in this study that was fairly recent in 2022, the H&E staining was done, which is basically just staining the cells to see them a little bit better, a little bit clearer. These techniques were analyzed in fetal adult lambs to indicate that the mutated PAX2 expression through the obstructive uropathy is associated with cyst formation and further MCDK. And this is the image here in which we can see the urinary tract obstruction in the models that display the MCDK, resulting in many cysts surrounding by the fibromuscular tissues. This is the duct stirring term right here. We see all the cysts. Other than that, that is